In this procedure, you'll learn to inform patients of their financial obligations and discuss their accounts professionally and sensitively. Determine the patient's financial responsibility under her insurance plan. Be sure you understand the terms of the plan well enough to explain them to the patient. Review the patient's account record carefully to confirm how much she owes.
Please come into my office. Have a seat.
Talk to the patient in a private area where you can't be overheard.
How's your day going?
It's going good. What
Good.
about yours?
It's been nice so far, thanks.
Explain how much the insurance covers, if any, and how much the patient must pay.
I understand you have some questions about your account. I really appreciate you coming in to clear things up, Amy.
Look, when I called to make this appointment about the bill, I didn't understand why there was a bill. I thought that my insurance covered everything.
Be professional when discussing the situation with the patient.
So insurance will cover 80%, and your responsibility is the other 20% of the amount billed. Your 20% comes to $170. Does that make sense?
Verbal and nonverbal communication should demonstrate patience, understanding, and sensitivity. Refrain from rolling your eyes, using a harsh tone, making disrespectful comments, and similar inappropriate behavior.
I don't know what to do. I can't spare $170 right now. My daughter's in daycare. They're talking about cutting our hours at work, and my son needs braces.
Not to worry, Amy. You don't have to pay it all at once. We can set up a monthly payment plan that you can afford. How much do you think you could pay on a monthly basis?
Offer payment options consistent with the clinic's policies and the patient's budget.
We can definitely make that work.
Never harass the patient or try to force her to pay. You'll be more successful if your communication is respectful and kind.
So that would be 4 months at $40 and 1 month at $10. Does that sound okay to you?
Yes, I can do that. Thanks for letting me make payments.
Great, no problem. We'll send you a statement each month to remind you of the amount due. Do you have any other questions?
Do I have to make the first 40 right now?
Not until you get the first bill. Why don't we make that due on the 15th of each month?
Oh, I'm so relieved. Oh, it's almost 3 o'clock. I had to pick up my daughter from daycare. Thanks again, Laura.
No problem. Happy to help.